Hey, so today we're going to be talking about community health and social media. My name is Patrick Caro. I'm trying to figure out YouTube. I'm not the best at it, so thank you for kind of observing it with me. But today we're kind of talking about different ways we can have public health and use social media to kind of integrate both platforms to really help and bring about change. So the next slide here we have. So this is the next slide, and we're talking about public health issues, and we're talking about oral health. And so the biggest thing is dental sealants. The reason I chose this is because sealants are very beneficial in the field of dentistry. They prevent 80% of cavities and back teeth in the posterior teeth. And 60% of children ages 6 to 11 do not actually get sealants. So if these sealants can prevent 80% of the cavities and 60% of the children in the United States are not receiving them, that's kind of what's bringing about this awareness and kind of bringing about change. There's already many like efforts that are out there to help with this, and so I think social media and integrating it with public health to improve the number of sealants is kind of the goal. But the bigger goal here as well is children from lower income families are 20% less likely to get sealants. And this also changes with different demographics and different incomes. The nice thing about down sealants is it's fast, it's painless, it's cost-effective way to treat a large number of children who are prone to cavities or have a higher rate of getting cavities. So low-income children are 20% less likely to have dental sealants placed and 2 times more likely to have untreated cavities than higher-income children. School-age children, age 6 to 11, have 3 times more cavities than those children who have dental sealants. And sealants can really help improve the oral health of these environments and in these demographics. And that's kind of what really inspired me to bring about a oral health campaign. And so with the campaign, we have a specific audience. And so our specific audience are children, or teenagers, 18 years and younger in Arizona. I kind of picked the location to kind of help bring about this campaign. And on top of that, it's also, I said mothers, but it's also parents, of children ages 18 years and younger, because it's not just the children, but it's also the parents who kind of help bring about the sealant campaign and kind of help them through the process and kind of bring them to the appointments, right, to get it done. The purpose of dental sealant campaign is to increase awareness of dental sealants. The biggest thing is a lot of people do not understand or are aware of how dental sealants can really benefit their oral cavity and how it can help prevent cavities. There's always talks about, what do I eat? What do I do? How many times do I brush? And this is one aspect. This is preventative care that can really help improve um, or decrease the number of cavities that children experience. And another thing, a purpose of the sealant program is to encourage dental sealant program behavior. So it's not just about the awareness and educating populations about the benefits of dental sealants, but it's also encouraging the placement of the dental sealants and understanding the benefits of it and in a tangible way where people actually bring about change. So the specific strategy for dental sealants, by August of 2019, we hope to have a 10% increase in the recognition of dental sealant campaign, as measured through surveying by moms or parents of children 18 years and under in the Phoenix area. And we also hope to have a specific strategy for by August of 2020, there will be a 5% increase in the dental sealant placement as measured through a surveying of children 18 years of age and younger. It's kind of the goal. Next, so this is the social media strategy. I think this is kind of the main point of all all that we've discussed, and we're going to break it down into 4 different categories. The first one is a business goal, and so that one has a number of questions that we want to address in the campaign. And what do you know about your audience? What demographic must you consider? And how can social media tools be deployed to help you better understand your audience? So, the first one is it individuals, small groups, or formal organizations? I would say it's more like individuals and small groups, because small groups, as in families, and individuals, as in teenagers, to really bring about change when they fully understand the benefits of dental sealants. And then what do you know about your audience is that 60% of children 6 to 11 do not actually get the dental sealants. Um, and what demographics must you consider? This is very important because there's a lot when it comes down to the different types of backgrounds that we're dealing with. And so when it comes down to um, like Hispanics and blacks, the number of dental sealants in oral health really drastically changes. So Hispanics and blacks have twice as many untreated tooth decay than white children. And Hispanics and black children have lower dental sealant prevalence than non-Hispanic white children. So what this in general is kind of saying is Hispanic and black children have more decay that it's untreated, and also they have less sealants than white children. And I think that's a big factor into the demographics of it. And these are from the CDC, and what general and health literacy levels are presented. And so because of um, we're trying to go for grade school age reading level as well as adult reading level. The grade school reading level would be more beneficial for giving a broad overview of dental sealants and the benefits and how they're placed. And for the adult reading level, it would be more in depth about exactly how dental sealants are placed, the materials used, and what to expect during an appointment. So it gets a little bit more in depth on that level. Um, Another thing is social media, and how can social media help bring about awareness and change? And so there's many tools that can better understand the type of content that is best suited for school-age children. Like, for example, if videos or if photos are more useful to help convey the educational aspect and the placement aspect, um, will be something that can be very beneficial on a social media standpoint, as well as some based off parents and adults versus children. They might be using social media in different times of the day, and I think that's another strategy that has to be looked at, because children or teenagers you know can stay up really late, and they can probably be looking at these on social media, on Instagram or Facebook or Snapchat or Twitter or whatever it might be, in the early wakes of the hour or at night. A lot of teenagers, the first thing they do before they go to bed is check their social media, and the first thing they do when they wake up are check social media. So just better understanding when your demographic is actually looking at these platforms would be very beneficial. On top of that, is a better understanding when the parents or the moms or the dads are looking on these social media platforms. If it's during the middle of the day or if it's during in the early wakes of the hour, we'll better understand when to actually post the social media campaign content. So another aspect of the strategy is desired outcome. So what do we desire to happen during the strategy? Is we want to of the dental sealant strategy is increase dental sealant recognition by 10%. This is meaning by understanding and recognizing and better being aware of dental sealants and the benefits of it, and increasing that by 10%, as also increasing dental sealant placement. So one is adjusting the mindset and the behavior, and one is actually bringing about change through the behavior, and that's a 5% increase. And and mostly this is not through individuals or small groups or organization. It's mostly individual and small groups um, that we really want to bring about this change. And the main thing is just increase the placement and awareness of dental sealants. And this could be individuals or it could be families. Um, and that's exactly what we're going for. The next strategy is actually going for choosing tools. So, you know, we talk about a dental strategy or a campaign, and then we talk about different platforms, but how do we actually go about it, and what tools will we use in our toolkit to really bring about this change and awareness? So there's different social media platforms, there's different videos and community members that we'll be using, and the different platforms that we would use would be Facebook, YouTube, Twitter. And the nice thing about Facebook and YouTube and Twitter is they also have different parent companies. Like Facebook has Instagram, and that really connects both together. And the nice thing about YouTube is you can post the link of your YouTube video on the Facebook, and so it can really go both ways in that aspect. Um, and on Twitter, there's so many. If someone posts something, you can share it, and you can retweet it, you can comment on it, and really bring about a lot of traction that way. And I think those are the kind of platforms we're hoping to use. Um, and then the literacy levels for these can vary because for school age children, we might use we might use the same platform but a different amount of content. So we might use more videos or more easier to read, posts or blogs, and so that is something that can definitely be used. And for for adults or parents, we can definitely use more YouTube videos that have a lot more content, a little bit longer. School age children have a very they don't want to watch a 30-minute video about dental sealants, but maybe parents might want to watch something a little bit longer than a couple minutes to really get a better understanding of what dental sealants are, the materials used, different things to look out for, the appointment, what to do after the appointment. It can really all kind of bring it together, and so that's why these platforms can be chosen and used based and change based off content, time of day that can really benefit and gear towards the audience you're trying to reach. Um, And so another question is, how can social media tools coordinate, support, or enrich existing traditional means of communication? Well, social media can use the communication tools from like the dental website, for like example, AZDA, which stands for Arizona Dental Association. And it can really use that platform and as well as the school websites to bring about school-based dental sealant programs. And it can really help tag on top of that to really give parents and school age children more resources on how to bring more awareness about dental sealants and exactly how and where to have them placed, because that's kind of the ultimate goal, right? The next thing is another question is, how in depth would interactions need to be? The big thing about it is like a broad overview would be needed to benefit the more in-depth reviews of how dental sealants are placed. And you know, it's not too complex for video. It's something that can definitely be conveyed during videos, and I think that's a really nice way to educate the population, because if they are audio learners or visual learners, videos really bring both of those hand in hand to really educate for the dental sealant campaign. So another question is, are potential community members already gathering on a particular platform? And the Maricopa County website has a brief information on dental sealants. I looked up their website and was actually shocked and really happy that they had information about dental sealants, and they had a YouTube video about dental sealants, um, which was really surprising and really happy because it's something that's already kind of in the forefront. Um, the only the only things that I can see that it can really improve on is the fact that some of these YouTube videos and the whole website was about almost 4 to 5 years old, and so the content's a little different. The audio visual aesthetics are not as appealing as they could be. But the fact they have it is really great, and the fact that it's a brief overview of dental sealants is great. But they can include more links about how they can bring about get more information. Uh, Link it to the CDC website. Link it towards the ADA, American Dental Association website. Link it to areas where they can get teachers or parents can get more information. It's something that's very important. And the nice thing is the AZDA, which is the Arizona Dental Association website. They also um, had less info about the dental sealants, and that was shocking because Maricopa County website had more information than the dental website. And I think that was a big shocker because I expected more from the dental association. And so I think that's something that can definitely be improved on. And these platforms need to penetrate the audience on a good amount. So um, Maricopa County had a Facebook actually. It had a Facebook page to, and it's called Maricopa County Office of Oral Health. So it's not just general health, but it's also they had a specific page for oral health, and that has the last post on that was in 2017, and we're at 2019, and so that's already been 2 years, and they haven't had a post since. So I think that's something that can definitely be looked at and definitely improved. Um, the next thing um, is this campaign pretty much can it inspire online community members to try a new platform? I don't think it would be trying them to try a new platform, but to use existing platforms that are already out there, like Facebook and YouTube and Twitter, that everybody's already using, and to kind of enhance them, to really draw in more viewers, to bring about more awareness, and that's due to videos and posters and flyers. Anyone that has access to the materials has a goal is to reach as many people as possible. Um, yeah, the next strategy was measurement. And so when it comes to measurement, it's like we talked about what the strategy is, which is dental sealants, why it's important, and that was due to the different demographics and a lot of populations not having dental sealants and reducing the amount of cavities and decay in school age children. And we've also talked about different platforms to use, like social media and the different platforms that it can provide. But how do we measure if it's successful? How do we measure if we can adjust it or change it based off of um, analytics that we're receiving? So the success, the behavior, the attitude, and the return on investment, these are all the things that come into the strategy. So the success of the campaign would be judged on Google Analytics, another company's Brandwatch, and Sprout Social. These are all companies that can really help us better understand and measure what we are actually viewing on our social media campaign to really help adjust the campaign to see if it's successful, to see if it's not successful, and there's adjustments that we can make to make it successful. All these measurements provide a different way to analyze our actual social media campaign. So it says how you measure behavior change. So we can look at metrics like retweets, comments, replies, likes, and at the end of it, just pretty much talking about participation. How many viewers are we having that are actually watching the content and actually doing something about it? And that can be from a like, a comment, asking questions. And then another thing is how will you measure attitude change, and that's pretty much volume and how many people it reaches and how much exposure we get and how many how pretty much it amplifies. Um, and then what actions taken by your audience will indicate successfully achieving your goal. An increase in awareness and engagement, ultimately getting a dental seal in place. That's kind of the ultimate goal. Um, and there's not really exactly immediate goals that you can measure along the way, but you can see that the return on investment is another aspect of it, and that's just seeing like how much you're putting in and how much you're getting out. And it's seeing like that their dental sealants protect against 80% cavities for 2 years. But that's kind of that's just kind of a time frame. That it's not actually an investment or return. But based off the CDC, applying sealants in schools for about 7 million low-income children can who don't have who don't have sealants can actually save up to 300 million in dental treatment costs, and that's actually very important because that's um, that's something that a lot of these children do not have the resources for. Don't know why I can't speak right there, right? Um, and it's just nice to know that you can actually put a dollar value towards early preventative treatments that can have a really long lasting effect. So I chose a couple platforms and kind of talk about the pros and cons of each. One is Facebook. If you haven't heard of it, it's one of the biggest platforms that everyone uses from different age groups and different demographics. So the pros of it is easy to use. It's very easy to post. It's very easy to like and comment and kind of navigate towards it. It's easy to share and add links. You don't need to have that much of a dental of a technological background to understand how to copy a link and share it, write some comments, and really share it to your audience and the people who are following you that are your friends. It's highly integrated, meaning that you can copy and paste a link on YouTube and share it on your Facebook so all your friends can view it. And you can Instagram it. And if you Instagram it, you can connect to your Facebook so it posts on both of them. Another thing is stories. There's Instagram stories and there's Facebook stories, and they kind of all integrate together as well. And there's a large number of users from both different backgrounds, different demographics, and there's just a lot of viewers on there. And the dental sealant campaign can use all of this in a very effective manner to post videos, to post flyers, and provide an environment where people can comment and ask questions, get resources to links and YouTube videos and Instagram stories to get a better understanding about dental sealants and their awareness, their benefits, and how to get them placed and where to get them placed. Um, the cons are exposure. In order on Facebook, there is a lot of friends, but we need to target it to a certain location and target to a certain population, meaning parents and of school age children. So that can be kind of hard to kind of geotag that. And you need to have a way to target certain populations based on location demographics, which like we talked about. And it's also sometimes it may cost, to advertise on Facebook. There is a financial cost to that. Um, it's just another aspect to kind of think about. There's always ways around it, but we're right now we'll put it as a con. Another thing is a YouTube. YouTube is like we talked in the previous slide. It's highly integrated into your Facebook, and you can copy and paste links and give it a lot of resources. And if you have a lot of videos on there that links dental sealants, and you can have it geared towards different populations and demographics. For example, if it's children, might have it shorter videos. If you have it parents, you can have more in-depth resources and different ways that they can get involved, and just more in-depth, I guess, videos to describe dental sealants. But the nice thing is a large number of users in YouTube. You can create a variety of videos with varying content and length. So like, for example, like long videos and short videos, long videos for more parents and shorter videos for, the school age children. You have easily shareable through Facebook. And the cons are it potentially could cost to put these videos together. And if you want to make a high quality video, you might need to hire a company who has, a nice camera and nice aesthetics, and they can really, edit it properly. And also gear it towards different demographics. So creating a video is one aspect, but getting it in the right hands of the viewers of certain populations and demographics is another aspect that can be difficult. Moving on to the next slide. So how would the dental sealant campaign be implemented? I think a pre-test would be very beneficial to kind of test out the content, test out the videos and the photos and the flyers and see what works best. And on top of that, it'd be very beneficial to get an idea of the time of day and if there's certain times of the day that are better adapt to different populations would be something that can be tested during the pre-test. And also helps with like, you can pre-test it for a certain number of months on a certain budget. For example, if you did it from like September to December, just like a pre-test to kind of get a better idea of your audience. And then, after the new year, you can really start the campaign from there, just kind of an idea. And these can be videos and photos and flyers where it can really help get a better better gauge of your audience. And then after you get all that data, you can revise content from the pretest to get a better idea of when you actually start launching to hit the ground running, and knowing exactly and gearing it towards areas where you're not going to be successful. So evaluation of Google Analytics. This gets more in depth of the evaluation. English is not my strong suit on Sunday. um, so this is pretty much the first one we're talking about Google Analytics, and this pretty much helpful for social media and analytics too, as it can help web traffic and target audience and make adjustments, make improvements. So it kind of helps you gear towards your audience that you really want to strive for the dental sealant campaign. For example, school-age children and parents of school-age children, and it kind of really helps target those areas. So this can be an idea of how much traction a post or tweet has generated. Google Analytics has shows who is visiting the site and from what website they came from and going to. For example, if they found your link of the Google of the dental sealant campaign through Google. They might, if they Googled it, or if they found it through Facebook that added a link that got them to the website, or if it was on Instagram or stories, it kind of gets a better idea of where exactly your audience is coming from and what demographics they're coming from. And it can differentiate if someone clicked on a click from Twitter, Facebook, or a blog. And it can help visualize trends, as it can show if a certain platform might draw more attention from certain demographics. The Google Analytics can also show how long a person is spending on a particular page. So for example, if they're spending 5 minutes on a YouTube video and they're moving on, or if they're rewatching the YouTube video over and over again, it gives you a better gauge, an idea of if that YouTube video was helpful. So if they have to watch it multiple times, it kind of gives you an idea like, hey, maybe we can adjust the YouTube video for the dental sealant campaign to give more information in a more concise way to help better understand for that certain type of audience. Another thing is the dental sealant program will have educational videos, photos, and website links to help inform parents and kids about the importance of dental sealants. Google Analytics helps track which social media platform, content, and even demographics that are being drawn in, and that's really helpful to Google Analytics. The next evaluation would be Brand Watch, and that's kind of self-explanatory, but it goes more into depth than that. It's a useful tool when it comes to keyword trends and audience behaviors, their perception, their attitude, their specific location. Google Analytics gave a good overview of where traffic is flowing, and this gives a good information about that traffic's perception and attitude, and where does that traffic come from. So that's kind of nice. So it can be used again, I can't speak English today. It can use statistical data generated from the various social media platforms in order to show audience behavior towards the dental sealant program. The tool can be used to show the audience perception and attitude towards dental sealants. So, for example, if they're viewing dental sealants as a good thing or a bad thing, or if the content is good or bad, or if the video is not as educational as they thought, this data can be used to better target content. For example, if there's a number of posts discussing the negatives of placing of a man-made chemical into the body. So, for example, sealants aren't exactly organic materials. So these are things that are man-made, and so some demographics, some populations, and some age groups might not like that. So if there's certain populations and location that do not that are commenting about the chemistry behind dental sealants, then maybe having educational flyers and videos and photos towards those populations could better enhance the awareness and placement of dental sealants. It's kind of what we're going for there. Um, so we talk about the location. This can help the sealant program as content be location specific. We're moving on to the last evaluation, which is Sprout Social. And this is the nice evaluation for our analytical tool because it can help be beneficial with the dental sealant program to help engage how quickly your question or concerns are addressed. So Google Analytics said, where exactly are our audience coming from? And the last evaluation was talking about their perception towards dental sealants and kind of have a better understanding of where they're coming from and if there's any adjustments on their videos that they can improve on. Sprout Social, seeing how well customer service is. So how it integrates all reporting from Facebook and Twitter and Instagram and Pinterest and Google and LinkedIn and uses all that to get an understanding of if audience members are asking questions, how quickly are the response? How fast are we addressing their concerns and how many outgoing messages are there or inbound messages about a certain topic? So if there are a lot of inbound messages about how do I get it down to ceiling? Where do I get it? What age group do I need to be? If there's a lot of questions that are very similar, it kind of helps, strategize exactly where the content needs to address first. This can better understand the type of message being sent by volume. So, for example, like we talked about, a number of questions that are talking about the same topic. This can help the dental sealant program better understand the type of question and the quantity of similar questions in order to gear more specific content, which is very helpful. Um, Another thing is possible changes for the future. We talked about the different websites like the Arizona Dental Association, as well as um, we also talked about the Maricopa County oral health website, and they both had decent resources, but I just think they're outdated. It's been a couple years from the Facebook post for the Maricopa County. There's been not as much information on their website about the benefits and exactly how to get dental sealants placed and where to get them placed and what time and what age. Just more information for parents to really bring about that change. Um, and honestly, like, this is 2019, and so uh, public health and social media is not something that is has a lot of information on, and so I think it's definitely a hot topic where there will be a lot of growth in the next few years. And so once that growth occurs, there'll be better analytics, better tools to really help engage the audience, to figure out where the audience is, where they're coming from, what age group there are, what specific location they're coming from, and just analyzing all those content in a way more efficient manner to really gear towards your content of sound sealants, of how they're placed, how like what the materials are used and how to get them done and where exactly are the benefits and where do you see them. So I think that can all increase with the future plans, and I think that's something that can definitely happen. um, I think we covered everything. I just want to say thank you for listening. I know it was kind of a long ordeal. It's supposed to be 10 to 15 minutes. I think we definitely went above that. There's just a lot of information, um, and in different ways we can really strategize a dental sealant program, to really bring about awareness, and using social media to do that. I think it's a really cutting edge thing. I think it's really benefit a lot of people. The first thing as millennials we do, and a lot of parents are nowadays are becoming millennials, to do our, we use Google, we go online, we look at reviews, we go on Yelp and Facebook, and we see what our friends are talking about, and seeing if other, I guess, friends and audience, people who like your content are looking at. It can really help gear towards this behavior of bringing about more engagement and awareness of dental sealants, and understanding the benefits that it can really prevent 80% of cavities for 2 years. That it can really decrease the number of caries rates we have in the United States and in the world. And it all occurs through social media, and social media is a way of kind of that one-on-one kind of advertising, versus a company advertising towards you. I think that's something that can definitely be used. And yeah, thank you so much for listening. And we're done. Thank you.